What's up guys, how are you doing? I hope you're doing okay. Today we're going to talk about acute adrenal insufficiency. What the hell is acute adrenal insufficiency? This condition is characterized by insufficient, partial or complete production of hormones produced by adrenal glands located just above the kidneys. These hormones include glucocorticoid like cortisol and mineralocorticoid like aldosterone. It is a very serious condition that can be fatal if not treated quickly. So it's important to start treatment immediately even if the diagnosis has not yet been confirmed. Hormone tests can be performed later once urgent treatment has been initiated. On one hand, the lack of cortisol leads to several symptoms, including intense fatigue, also called asthenia, muscle pain or what we call myalgia. In addition to these symptoms, cortisol deficiency can result in low sodium levels in the blood, what we call hyponatremia, and an increase in ACTH, which is a hormone that stimulates the adrenal glands to produce more cortisol. On the other hand, the lack of aldosterone causes a decrease in blood volume called hypovolemia due to excessive loss of salt in the body, which can lead to a drop in blood pressure. A low level of aldosterone can also cause an increase in potassium levels in the blood, or what we call hyperkalemia. Kalemia meaning potassium levels in the blood and hyper meaning elevated, which can be very dangerous for the heart. Well, the clinical symptoms are sufficient to make a diagnosis and start treatment without the need of additional complementary exams. Most of the time, acute adrenal insufficiency manifests following a progressive episode of chronic adrenal insufficiency. This means that acute adrenal insufficiency can develop or worsen after a specific event or change in the patient who suffers from chronic adrenal insufficiency, even if the symptoms were previously mild or unnoticed. It is important to know the patient's medical history, such as chronic adrenal insufficiency, as we said before, or signs that might indicate this issue. For example, changes in the skin color like melanoderma. Ask if the patient has been treated with anti-cortisol medications or if they have recently stopped long-term corticosteroid treatment. Also, you should look for any factors that could contribute to acute adrenal insufficiency in a patient with a chronic adrenal insufficiency, like discontinuation of treatment, a salt-free diet, pregnancy, infection, trauma, surgery, or something else. The loss of salts in the body may be due to vomiting or diarrhea, as well as the use of medication like diuretics or laxatives. Acute adrenal insufficiency is characterized by a clinical presentation with various symptoms. First, let's start with signs of cardiovascular collapse, which is characterized by shock presentation, meaning the patient may have severe hypotension, pallor, sweating, cold extremities, and weak pulse. Secondly, intense digestive symptoms like abdominal pain, sudden vomiting, or significant diarrhea. Thirdly, some sign of severe dehydration may appear, like a sunken face with deep set eyes. The patient may have skin that stays pinched for a long time when squeezed. Neurological signs can also appear. The patient might present consciousness disturbances such as confusion or coma, as well as seizure may occur due to the low sodium levels in the blood or due to hypoglycemia. Finally, the patient may also experience diffuse body pain, including muscle pain, headaches, or others. Generally, a sudden febrile shock presentation should signal acute adrenal insufficiency. When it comes to complementary exams are necessary, but none should delay the immediate management of the patients, as this is a life-threatening emergency, as we said before. CBC might show hemoconcentration, meaning an increase in the concentration of red blood cells in the blood, secondary to hypovolemia, and blood unigram and blood glucose to check for the three main abnormalities: hyponatremia, which is a low sodium level in the blood; hyperkalemia, which is very dangerous, meaning high potassium levels in the blood; and hypoglycemia, which is low blood sugar. Additionally, renal function tests to detect any acute renal failure, often caused by dehydration. Low cortisol and aldosterone levels are measured later, confirming the presence of adrenal insufficiency, and blood gases to check for any metabolic acidosis, meaning excessive acidity in the blood due to the metabolic imbalances. ECG or electrocardiogram is also important to check for any signs of hyperkalemia affecting the heart, such as peaked T waves, widening of QRS complex, or severe arrhythmias like ventricular tachycardia or ventricular fibrillation. Other additional tests may be performed depending on the patients to identify any triggering cause, such as infections workup to rule out any infection. The causes of this disease can be either peripheral, meaning the problem lies at the adrenal level, or central, where the hormone production by the adrenal glands is insufficient due to dysfunction of the pituitary or hypothalamus. Let's start with peripheral adrenal insufficiency, which can be triggered by the previously mentioned factors causing the compensation of chronic adrenal insufficiency. It can also be primary, meaning occurring for the first time, or secondary due to several etiologies. These etiologies can be lesions of both adrenal gland caused by bilateral hemorrhagia, often related to blood coagulation problems, thrombosis in the adrenal gland vessels, sometimes associated with diseases like lupus or antiphospholipid syndrome, and the presence of cancer that has spread bilaterally to adrenal glands. This secondary adrenal insufficiency can also be caused by purpura phenomenon or by a complete enzymatic block, which is a rare congenital abnormality where an enzyme needed for the production of adrenal hormones does not function properly, which is usually diagnosed at birth. Anti-cortisol treatment like mitotain, which reduces cortisol production and is used to treat certain adrenal tumors. Now let's talk about central adrenal insufficiency. A prolonged corticosteroid treatment, if improperly stopped, can disturb the hormonal system, and an insufficiency of the pituitary gland due to a tumor infection or other cause such as sudden bleeding can cause this condition. And in rare cases, highly stressful emotional events can disturb the central hormone balance. So in summary, acute adrenal insufficiency is a condition characterized by insufficient production of adrenal hormones. This deficiency can lead to various symptoms such as intense fatigue, muscle pain, and hypotension. The diagnosis mainly relies on clinical findings with essential complementary tests, but these should not delay urgent treatment. And the causes can be peripheral such as adrenal lesions, or central related to dysfunction at the central level. We will talk about the treatment and management in another video. Thank you so much for watching until the end, and I hope to see you in the next video. Bye bye.